morning, everybody. Happy Thursday. Welcome to our Natural Health News live show here on YouTube and Instagram. Every morning, I bring you a Natural Health News live show focused on the virus updates, the latest research that I have a ton of today that we're going to cover. And we're going to talk a lot about some of the latest in specific information about blood clotting, complications, blood clots, thickening of the blood that particularly here in the US, in New York and other states that are in the top 7, 10 most diagnosed states, these doctors are seeing these really bizarre thickening of the blood and abnormalities, microclots, and we're going to talk about that. I'm going to share with you the latest information. We have some data. We don't really know why. And I just want to remind everybody, this is a novel situation, which means it's new, unprecedented. We've never experienced this. We've never seen this. And because of that, there are a lot of new and unique symptoms and co-symptoms, co-diseases, co-disorders that are they're creating a lot of questions. And so I know I get a lot of emails, I get a lot of comments from all of you. There's a lot of frustration, and I totally understand. And it's very frustrating, I know, for the frontliners in the medical community. But we just have to really remember and just set our expectations. This is stuff, this particular virus, we've never experienced this. And because of that, our amazing medical community, our ICUs, they're gathering more data than what we're seeing across any other country. So that we're going to rely on today. I'm going to really highlight a whole bunch of data that is up to date and share with you a bunch of articles. All of them are posted below. And I welcome all of you joining today. This particular topic is one that's close to my heart, literally, figuratively, and historically in my own family's DNA. Heart disease is really one of the major underlying conditions and health concerns that it seems like this virus is affecting. And in my own family, we have one side of my family I know all about, and my dad was adopted, so that's a big question mark. But heart disease, blood clotting, strokes, things like that, that history is something I work really hard on to address. And I know a lot of you have the same concerns I have, maybe even have the same family history or even diagnoses. So we're going to address that in today's video. And I'm going to share with you some natural resources that you can employ in your life. I do and have been doing already. And so we're going to talk a little bit about that. I'm also going to talk with you about how a lot of the medical providers are coming together. They're starting to establish a newer protocol to address the blood clots. So stay tuned with me. Welcome all of you joining. If you are new, please hit that subscribe and follow button. Every morning, 9 a.m. Eastern time, I bring you this live show. And there are two parts to this show, just to set the expectations. And for all of you on the replay, the beginning part, we go over a whole bunch of news, a lot of data I write down, statistics, and then we usually have some sort of related health kind of topic that I offer tips, techniques, resources, DIY. My job is, so I'll just introduce myself to you. I'm a naturopathic physician. My name is Dr. Melissa Gallagher. I practice in Georgia. I actually was born here, but I spent my childhood growing up in Florida. And after I completed my master's and doctorate, my doctorate was up in New England, I moved back home and opened up my clinic and wellness practice in St. Petersburg, Florida. So I've been doing this for over 15 years. But yeah, 15 years. It's so crazy. I don't feel like I'm that old. In my head, I'm still 29. Comment down below if you can relate. But I have been doing work with individuals in the naturopathic space. And naturopaths, we study basically what is now being known as functional medicine. We address the root cause of illness and disease and target all of the body systems, all of the imbalances within your body to help you rebalance, recalibrate, and bring homeostasis to the body in the healthiest, most optimized way. And so nutrition's part of it, homeopathy, herbology, looking at enzyme therapy. We address digestion, lung, heart health. I work with a lot of post-surgical cases, cancer patients, and I also have a specialty in the lymphatic therapy world. So that's a little bit about my background. And I think that's important too with these live shows. One, this is unedited. This is totally me talking to all of you. And we always have it ranges anywhere from 2,000 to 3,000 of you who join me on the live. And we talk a lot about the specific state of the virus and how it can impact you and your lives. Also, resources to keep you and your families healthy and safe. So with that being said, I want to again welcome everybody. Comment down below. I've got Maria. Good morning, Maria. On the live, she was one of my St. Pete patients and customers down there. So let's talk a little bit about where we're at. So in the US, we passed the 850,000 threshold. We're at 855,250 cases. We have almost 48,000 deaths. And, there are some states that are kind of inching up that threshold. So New Jersey is going to be hitting 100,000 very shortly. We're seeing Michigan and Pennsylvania, those numbers increasing. Massachusetts is up there as well. And again, all of those areas where you're seeing higher cases, all of those clinicians are the ones who have come together and we're getting a lot of good data. So I'm going to highlight also the Journal of the American Medical Association, JAMA, J-A-M-A. They released and it's not just, it's an extensive piece, and I'm running out of printer paper. You guys see that empty box there. So I was able to print that. But they released a snapshot of New York City. And it digs, the graphs are pretty substantial. It digs into, the particular types of cases. Honestly, the most impacted are folks with underlying heart disease, but particularly high blood pressure. So this is going to hit home as well for any of you who are dealing with high blood pressure. Sometimes the medications might be a factor, and they could dig into the morbidity mortality rate. I know somewhere over there, I've got an accordion file of all of my reports I printed. But yesterday, the CDC MMWR, the Morbidity Mortality Weekly Report, that also highlights the underlying conditions. But New York specifically is what was targeted. And we are going to drill down into those specifics, but I just want to highlight what caught my attention. And it was in researching yesterday's the COVID toe video, which, by the way, watch that because of the skin condition, the skin rash that occurs. I ran across the data. 20 to 40% of the individuals who come in and are suffering or maybe even die at home, 20 to 40% of them have some sort of blood clot factor. And so neurosurgeons are seeing greater instances of strokes. They're also seeing the nephrologists having issues with they're getting blood clotting in the dialysis machines. Really bizarre stuff. So that caught my attention. That's why I wanted to talk about today's topic. So let's dig into that. That JAMA report, it identified that just in New York hospitals alone, not New York City, but New York, the whole entire state, 88% of the patients who are ventilated, those become fatalities. So that harkens back and goes back to what I talked about last week about the changes in, I think it was last week, everything kind of blends together. But the highlight that I mentioned before is that doctors are reassessing the nature of the pneumonia. Like people who should, honestly, their numbers, they would be presumed dead, are like scrolling on they're talking on the phone and they're like in the ER on their phones, and their oxygen levels just don't match their capacity. And that's why they're starting to utilize like high altitude medicine for those cases. But again, that goes back to our protocol for what we know is to put people on ventilation. What they started to analyze is that might actually be causing greater damage on the kidneys, and folks crash more frequently when they get intubated and are on ventilation. This data backs that up, 88%. Okay, so I'm going to give you a whole bunch of news. all over. Okay, so the New York Stock Exchange has announced that they are going to roll out a reopening in multiple phases starting on the 15th of May. All of the traders are all working electronically. The good news is we are an electronic society. A lot of our business can be electronic. Second thing out in New York, this is so sad. You guys know I'm like my first love as a pet love are felines. I was a cat owner for over 16 years and my last kitty just passed. We're coming up on a year. Ugh. And I still miss felines. And so I saw a report that there were 2 kitty cats that tested positive. They came into the vet with respiratory distress and they happened to get exposure either from the owner or from, their street living. So that just FYI for all you kitty fans and kitty lovers, we have seen that in the zoo and, the Bronx Zoo, translation to lions and tigers. We've also seen that one case in Hong Kong, a transmission from human to dog. And so that is a possibility. Okay, so here's some interesting stuff. I want to talk about airlines here, some airline news. There is the first lawsuit. I'm going to be highlighting the lawsuits because we're going to start to see more of that. There's a class action suit, first one ever, filed against American Airlines because of their initial refusal to issue refunds. And many of you know I had speaking engagements. I had a conference in Vegas and we had our wedding. So there were multiple airline tickets that that I had to address and change. And I actually only got Brian and Gabriel's refunded. I didn't fight it, but now I'm thinking I should go back and fight it. I will be traveling a lot. It's part of the job that I do. And plus we have our wedding next week, next year, knock on wood, that there's no social distancing to ruin that. But that is really big because the airlines obviously were aware that things were going to go down pretty quickly. And that started to happen in early March. The other thing, at least early March here in the US, Delta's CEO was interviewed. I actually watched it. It was on CNBC. And he highlighted, as the Delta CEO, they've seen now only 5% they've dropped by 95%. So only 5% of their fleet are being utilized. And even then they've even mentioned that sometimes there'll be one person on a flight. Lots of restrictions in terms of that travel component. But he highlighted something that you're going to hear more about. I don't know if it was an off the cuff kind of comment or if there's really true some sort of underlying development that we need to be aware of. But he mentioned something called immunity passports. And he talked about, the goal of airlines is to keep it safe and healthy. And, that there may very well be a point where people have immunity passports, meaning if we take antibody tests and we identify we've either been vaccinated or we have the antibodies and we're safe, that clears us for travel. So he was highlighting it as potentially safe, as a potential safety measure, but I know people are going to freak out about that. And it was just like a comment, but it definitely was like, ding, what is he saying? And there's no sort of background provided. So let's just table that and watch for that. I will stay on top of that one. Okay. The other thing, I talked a lot yesterday about the FEMA seizing materials up in like mid-Atlantic. Well, apparently they've seized materials that were bound via flight to Miami-Dade. Miami-Dade is one of the hot spots. It's the epicenter in Florida. And even the mayor of, I think, South Beach or Miami had the virus a few weeks ago. Well, FEMA has seized Miami-Dade PPE, strictly N95 mask, destined for the Miami Fire Department because they were going to start to test medical workers and they were going to be doing these rapid tests. Well, the only way for them to do that is to wear protective gear, and it got seized by FEMA. No reason. It was a perfectly legal transaction from everything I read. And also, not only were those masks destined for Miami Fire Department, it was also destined for the HCA. It's a medical community down in Miami-Dade. And they're being the hardest hit. So that's also there. The CARES Act, I want to highlight some of that. As a small business owner, we're okay. But I have a lot of people I know back at home and here, even our clinic, the clinic owner up here. I'm tuned into the small business world. And so also I have a lot of, banking relationships, and I have a lot of online digital merchant services. So I'm getting these emails a lot from all of these providers. Even PayPal is trying to figure out how they can help small business owners. One of the things that was highlighted, I think I mentioned it last week, one of my entrepreneur network friends back at home in St. Pete had mentioned that one of the banks there, the banker got him the PPP loan. So he got that process, but he said that the banker mentioned he was getting a 5% fee on the loan he was getting. Well, that has come to term, and it is anywhere from 1% to 5% of the fees. The banks have made $10 billion on the PPP heading to small businesses. We know a lot of small business owners that could use that 10 billion. So we've padded the pockets of the bankers, and I get it takes a lot to process these fees and whatnot, but I mean, come on. Okay, so and we are working on a new stimulus package that still is outstanding. I haven't even dug into that. I've been so immersed in this stuff. I promise I'll report more details for you guys. All right, some international news. They are seeing some spikes in Southeastern Asia. One of my contractors that works for me that does websites development and kind of helps me maintain my website, he's in India. India is on full lockdown, and they actually have an increase in cases. And then also there is a cruise ship. There's been a lot of cruise ships that are just kind of put on pause. So a lot of them are just in dock or, at port. I don't know the terminology, but they're sitting there. So these individuals are staying on the boat. They're not getting off. But there's an Italian cruise ship that's docked in Japan off the coast of, or in port in Nagasaki. And 48 cases, 48 crew members have the virus. Japan only has, it's a lot still. It's 11,000. They have 11,500 cases. But they're looking at the concern of these 48 cases. If they are going to need medical attention, that is going to overwhelm the Nagasaki medical community. So this just plagues everybody. Okay, so Kenneth, have we got to the blood clotting yet? Not yet. I'm getting there. So on our live show, I always report the news, and let me know, you guys, do you like the news? Do you like this portion? Do you feel like you get educated? I get a lot of flack sometimes with the news that I'm babbling on too much, but I know a lot of you tune in to hear it here, and then you tune out and aren't, staying on top of the news because it's very stressful. So I always try to say this and highlight the news piece in the most positive way. But part of this, it's also my own need to research and know and understand. So yeah, thanks you guys. So just be patient, everybody who wants me to get to the gist of it, but I'm here. Okay. So here is what we're seeing. The coronavirus, and I'm saying it in this, I said it yesterday and I got dinged, but then I fought it and we were okay. So hopefully whoever reviews our video, thank you. You guys are doing hard work. But let's talk about the JAMA article first. And I didn't grab that link. I'll grab that on the processing. The JAMA, so the Journal of American Medical, or for the American Medical Association, JAMA, they released a snapshot of New York. The good news is that our healthcare system is really big about analyzing data. What we haven't gotten, we've gotten little tidbits, but we haven't seen that out of China. And Italy was so overwhelmed, they were just in survival mode. They're still there. Same with Spain. Hopefully I don't lose you guys. We've got weather problems here. So one of the things that we have is we've got data, and data is overwhelmingly powerful for us to assess what's happening, for us to get a bigger picture, for us to see trends and categorize also new ways of dealing with this novel situation. And we have the most cases in the world. So we're going to have more data than anybody else. So with that, I want to highlight a few things. There is there are several articles. Actually, I didn't print the Chinese one. Actually, I think I did. Did I? No, I didn't. Gosh, I have so many pages. Okay, so there's also a Chinese report that I have linked down below. I didn't get to print that with the paper issue. But here's what we're seeing. So just globally, JAMA identified anywhere from 20, 30 to 40%, depending on the patient population in the different medical facilities. So Bronx versus Brooklyn versus Westchester versus Buffalo and Albany and wherever. That depending on the type of patient profile that came in, this blood clotting abnormality was in existence in anywhere between 20 to 40% of the cases. And then they further went into what underlying health condition existed. Cancer was a big one. So these are the top ones: cancer, hypertension, and then even, I know they kind of went through hypertension, kidney disease. Most of it was heart related. So the top three were heart related. But there's also an underlying component that we are going to hear more about. And I know that these OBGYNs are just trying to get this data and trying to figure this out in their own worlds. But women, the blood clotting was really a factor for women who are pregnant. And it wasn't so much pregnancy, it's post-delivery. So women would deliver fine, and then they would crash. The placenta release maybe didn't occur all in the right way. And many of you who have had babies naturally or have had vaginal deliveries, that's part of the process. And that hemorrhaging is a big factor for the morbidity and mortality rates. The US is not great on those numbers anyway. We don't talk about that, but we're not great on those numbers. But what they were seeing is that pregnant women were fine, tested negative, up to the point they delivered. They'd retest them, and they'd crash or need to be ventilated. And there are even some cases, there was a case last week, several weeks ago, but last week, a mother came off the ventilation. So she was vented. She actually delivered naturally, vaginally. And this week she's posted pictures of her and her baby. I mean, could you imagine? And plus you're in isolation. But they are seeing these really weird blood clotting dysfunctions and disorders. We don't know why. So there's a question mark. We don't know why this is an issue. But there are a lot of complications and abnormalities. And it's involving not just the lungs, but all of the body systems. They've identified in the blood screens, they do a CT scan, or not the blood, the lung screening. So they analyze and CT scan the lungs, and they've identified that there are pockets of no blood flow. And those are from microclots or some sort of weird thickening of the blood. That thickening of the blood translates to, when folks are on ventilation, there's often dialysis. So they're reoxygenating the blood because the lung capacity is decreased. Well, these nephrologists, those are the doctors and the technicians that are running the dialysis machines. The blood is so thick and the clotting factor is so out of control that they're seeing clots in the actual clotting, the dialysis machines. And I don't know if you guys have ever seen it. It's usually a unit that's right next to the bed. They've got a factor that's going in and a factor that's going out. It's like an old movie reel kind of thing. It's just spinning. And what has happened is the blood clot. So I'm going to dig into this further in the second part of me explaining what this is and how to deal with it. But there are things that happen, and the technical term that we call it's homeostatic derangement. This is often post-surgical. And it could very well be that might be triggered by intubation or the virus. That's a question mark. Nobody knows. There's a lot of speculations, but there's some sort of blood-related trauma, and that blood-related trauma creates a situation where the blood is disorganized, and that disorganization causes clotting. But they're seeing some cases. They're seeing some cases of large blood clots. There are greater strokes happening in younger patients. So neurosurgeons getting called in for a 31-year-old who has a massive blood clot in the brain. 40-year-olds, very bizarre, abnormal situations. Drilling down, there's a lot of question mark. What were the underlying health conditions? We have a broader scale, but there's going to be more, there's going to be a deeper dive. But this is just higher level right now because this is all we've got. That doesn't mean that we're not going to get more information. But there's definitely some sort of assault to the blood and the process. And there's a lot of theories. One of the theories is that this whole cytokine storm I referenced last week, and please do watch that video. I have a whole playlist for all of you. Instagram, our shows are only up for 24 hours, but YouTube, they live forever. As long as they stay up, they don't get taken down. We're actually backing things up. I'm going to put out audio files on our website. But there is some sort of hyperactive inflammatory response that they're seeing in the blood. So I've highlighted the cytokine storm and how there's that hyperactive immunity or autoimmunity, and there's an attack of the immune system, and the body just starts attacking every organ and gland. We're seeing that also translated in the blood, and that might very well be part of this. It's just really abnormal. No textbooks reference that. And so they actually have Reuters, I think is the name of it. It has a really good article. I would recommend you just read the Reuters article. And they talk about like the different New York doctors. They interview several of them at the different institutes and facilities, like Mount Sinai was a big one that was interviewed. And they talk a little bit about the protocol. But there is one neurosurgeon who said in the 3 weeks beginning mid-March, they saw 32 stroke patients with large blood blockages in the brain, double the usual number for that period. 5 were unusually young, under the age of 49, with no obvious risk factors for strokes, which is crazy, very, very atypical. The youngest was only 31. And at least half of the 32 patients would test positive. So this is very interesting. This is not just a global look at the ICU patients. These are individual cases coming in for a different symptom or condition and then testing. And I think part of it is because of these hospitals, they're just testing people because of maybe some of the other symptoms they're experiencing. But the main factor that had brought half of them, or the main factor that brought 32 of them in was not COVID-19 symptoms per se. It was the clotting factor. And then they also talked about a lung specialist, talked a lot about the blood clotting. There's this pneumonia, and traditionally there's the stiffness of the pneumonia to the lungs. But he said it seemed blood was not circulating freely through the lungs to be aerated with each breath. And so that's a clotting factor and why it's a little bit unique, and potentially why the ventilation is not causing, but we're seeing 88% of the mortality, the fatalities from a ventilation. It's maybe not the right protocol. They also interview a nephrologist, and he talked about dialysis catheters. So those are the little, not syringes, but they're the plastic pieces that go in and out of those machines through the body. He said they were often getting blocked with clots. And he said, it's funny, not funny, but he said, in talking with one of the other doctors, he said, and I said, it's funny that you mentioned that, the lung clotting, because I feel like all these patients have blood clots in their lungs. So kidney doctor and lung doctor start to have a conversation and talk with the resident. And then ultimately he brings up the stroke factor, and they on Easter Day start to talk together, call these other doctors. And so this is a storyline of like how they started to figure out what was happening. Like this is just raw, real clinical analysis and how it unfolds. But on Easter, they said at 2:46 a.m. Easter Sunday, they started talking. They spent 2 days in discussions and meetings with health department heads all over New York and in some of the major cities that were having cases. And they put together a new treatment protocol. So this is really important to note. One of the treatment protocols that they are analyzing has been helpful is putting people on blood thinners. So addressing what we know, blood clots are basically fibrins. They are thickening this kind of fibrin matter I see fibrins in a lot of different cases with patients, deep vein thrombosis. We see this kind of thicker fibrins can be in existence with scar tissue. Same thing with a decrease in healing, wound healing. Fibrins can be a factor. And also in the blood, fibrins themselves, they cause this kind of, it's a thick protein substance, and the proteins get sticky. It's like sticky rice. We see this also in the lymphatic system. And in the lymphatic system, it often will create a condition called fibrosis, where their cellular changes. It sounds like we're seeing and hearing the same thing in the blood with these cases. So what happened out of this protocol in Boston at Beth Israel Deaconess Medical Center, they had started a trial earlier in the month. And they started a clinical trial with an anti-clotting drug to see if it would help the patients. And basically they said, clotting develops anytime you're, stable and not moving. But people who are ventilated or in the ER, they tended to see the clotting happen a lot sooner. So this is really new. Okay, so we're talking like analysis and sitting down and talking about a protocol on the 5th of April. It is now the 23rd. New. And this is still going to be something we dig further into. Also, because of what was happening up in New England and in Beth Israel Deaconess Hospital and other facilities, they, let's see, this is, let me see if I can tell you what hospitals. Okay, so this is in collaboration with, this analyzes, okay, this is my Chinese report. Okay, so this New England Medical Journal, so the New England Journal of Medicine, they actually posted, this is the Chinese data. This came out, I want to say the date on this is, it just was released 10 hours ago. But this analyzes, let me see if I've got the dates. It analyzes a patient back in January in China. And it goes through his CBC. So they draw the blood and they start to analyze the different values. So it's 3 different patients that are analyzed. All of them showcase this really unique kind of blood clotting element and an anti-phospholipid antibody. So this is going to be a new term you might hear, but essentially this is a body response to the virus. And it happens to be this sort of blood clotting abnormality where we see a buildup of proteins in the blood and it thickens the blood. Okay, so I also want to highlight what the one sentence here that I think is important to note. This anti-phospholipid, these antibodies abnormally target phospholipid proteins. So again, the proteins, they're targeted. And then the presence of these antibodies is central to the diagnosis of something that they call anti-phospholipid syndrome. So we might be seeing more cases here in the States that might be a ICD-9 code that coincides with the COVID-19 code. And we now have a code for the virus, for billing and all that. And this will also be something that will be utilized epidemiologically to study and analyze all of these cases. But it is very interesting. All 3 of these Chinese patients, they all have high blood pressure, hypertension, diabetes. 2 of them have hypertension and diabetes. One has stroke. Two have stroke. One has no sort of history of thrombosis. One has emphysema. Another one has coronary artery disease. And in imaging of the lungs, they identified they had microclots. So this really analyzes how this virus just kind of ravages not just the lungs, but we're seeing it now in other areas. And New York's really going to be, I think, fundamental in leading that charge. So Welcome to all of you new joining. We're just really kind of going over some of the new symptoms, a new symptom that now we are identifying as part of the virus and the way it attacks the body. And there is this really bizarre, unique abnormality that becomes a blood clotting, blood thickening symptom and complication for a lot of folks. So we don't know specifically why, but it is there, and there's a lot of just thoughts behind why this is happening, and there's a possibility that this might be an autoimmune reaction. Now, the last article, this is posted. This is pretty substantial. I think it was like 60 pages or so. This came out on the 15th of April. This is out of the journal of, JACC, which is the Journal of the American College of Cardiology Foundation. And they analyze, so the title is COVID-19 and Thrombotic or Thromboembolic Disease, Implications for Prevention of Antithrombotic Therapy and Follow-up. And as you can see, there are a lot of doctors. These are all the doctors involved in writing this journal article and the study. They're from all over: New York Presbyterian, Yale School of Medicine. We see there's Spain, Madrid, Italy, McGovern Medical School in Texas, Health Center at Houston, the Beijing, the Chinese PLA General Hospital in China. We also see Pennsylvania UPenn, the Department of Vascular Medicine up in Vermont, Harvard Medical School, Beth Israel Deaconess, that was that one that I referenced. We also see Verona, Italy, and Australia is in here as well. So they pull Australia. I mean, literally, this list from here and over here, these are all. So this is just a lot of people, a lot of medical providers, and a lot of individuals assessed. So essentially what they're trying to identify is how this happens, the epidemiology of it, and how to manage it, and what type of outcomes there are for this. But it is pretty substantial. They are seeing that essentially every body system is being impacted by the blood clotting component. We're seeing that in the brain, we're seeing it in the lungs, we're seeing it in the legs. There's a report. I don't know who he is, but there's an actor, a Broadway actor, that was hospitalized, and he had a blood clot in his leg and had to have it amputated. So, and he has tested positive and was in the hospital, but the blood clot is what prompted the need to have his leg amputated. So, this is going to be something, and it even says further system-based considerations should be made to monitor and analyze, essentially all the different factors related to these complications. But, there's definitely an identifying factor where, the patients with prior cardiovascular disease are at a greater risk for these cardiovascular complications. And blood, the hematology and the blood-related aspects, there's a connection, a correlation between the heart disease, vascular impairments. But then we have every system that gets impacted. But, the highlight that they talk about is anti-platelet agents and anticoagulants, which means basically they're looking at blood thinning therapies and ways to kind of manage the fibrin buildup. So with all of this being said, I want to talk to you about how I personally and professionally address patients and individuals who have any type of blood clotting, and there are blood clotting cofactors. You can have genetic elements, so you can get those tests. But let's see. So IMYs, why not cut clot out instead of amputation? Well, depending on the clot, and again, I haven't read the case, but it can cut off circulation. And so you lose tissue. And more than likely, I mean, amputation is a very barbaric procedure, and it's not something that's, one that is the first go-to. More than likely, they tried a lot of different things, but also the way that all this research is highlighting, this stuff is coming up fast. So people literally go from being okay and crashing in hours, sometimes minutes. So it is not like we've got weeks to heal or to enhance circulation. Sometimes it's so fast. And the nature of it, it could very well be that one of his main arteries was completely blocked. And you think about, you have gangrene that sets in. I mean, things that we don't really, I'm not laughing about this. We don't get exposed to this. I mean, you think about like amputation in war. A lot of these physicians are like, we're at war with this virus, but it's very, very intense. So yeah. But let's talk about, and I will tell you, my uncle had a situation before he passed. He had a thickening of his blood. He had the, fibrins that were developed. Part of it is, blood disease, or not blood, but heart disease, lack of blood flow, also dietary components, lifestyle components, stress is a factor, and just every day. And I'm going to talk about just every day. I'm not talking about like this particular virus-related symptom specifically, but, we do know that omegas, taking fish oils, are very good for keeping the blood flowing. The omegas are rich in the fatty acids. It's also a fat. So lipids are very good for moving other lipids. And so one of the things that we see is there's that kind of overwhelming amount of lipids that get coagulated and kind of connected. So that thick protein it's like sticky rice. They're all sticking together. If we have fat in our body, healthy fat, and often fat is going to come with certain nutrients. So omegas are really big. We should all be eating foods rich in omega if you can. And if not, there's plant-based omegas. There's omega 3, 6, 5, 7, and 9. A lot of people think of just 3, 6, 9, but there are other omegas. Some are plant-based. Amla is one of my favorite. It's a plant. It's great for skincare, but you can take amla supplementation and you get your omegas there. Some sea vegetables will give you omegas. And Vicky has a good question. What is the difference between fish oil and ubiquinol? So fish oil are omega fatty acids. Ubiquinol is CoQ10. Very big difference. Very big difference. So one is a essential fatty acid. The other is a coenzyme. And they often get lumped together, and you never want to take the two together. So, that's a big thing. That's a different topic, but omegas are really big. The one thing that I really am going to implore for any of you who may have some sort of tendency to blood clotting factors, or a big factor here for any of us, if you bruise really easily, that'll be an indicator of a deficiency of K2. K2 is an amazing anti-blood clotting nutrient that many of us are lacking. And K2 you can get it. The best form for how I recommend getting it is through butter, like butter oil, not like butter, the stick of butter, but there's something called butter oil. I've got links down below. Green Pastures is one of my favorite brands. And this is an Amazon link where you can grab it. They're a small business. They ferment cod liver oil, and they also have the butter oil. The butter oil is rich in K2. And K2 is like a scavenger of these thick proteins, and it'll start to help break that up. So partly it's a blood thinner. So if any of you are on any medications, always consult your doctors, always consult your pharmacist, before taking any recommendations or taking any of these supplements. But it's very important to consider. And one of the factors at play with K2 is that it keeps our blood thinner and it decreases the clotting. And it can also help with some of these like little microvascular channels that might be getting blocked from, say, a blood clot and or cholesterol. So a lot of folks will do cholesterol related testing. They'll find out this particle, the lipid particle size or the protein size. That is potentially a factor too with all these cases that we're seeing But again, we just don't know enough, but I want to give you what we know. So let's talk about K2. So the butter oil is something that's always on my agenda on a daily basis. K2, I actually have just re-upped my order. I put it in with my full script. I love the Douglas Labs. They have a K2 and an MK7, different forms, but essentially those two in combination are very powerful. It's a 90 mcg dosage that is really good at minimizing the kind of bruising that a lot of people see. Also, ladies, if you experience heavy clotty periods, thickening of uterine lining, and I have a YouTube video on this that I shot probably a year and a half ago, maybe longer. K2 is a deficiency that will cause that. And then also there's hormonal factors. So, I've talked in this video series, but also outside of, outside of this series and the live show, talk a lot about hormone deficiencies. Progesterone deficiency can also pair up with a K2. So there will always be underlying aspects at play. It's not just one thing that might be a factor, but we definitely do need to balance all of that. The food-based K2 that I love is ghee, and ghee is spelled Ghee. And ghee is, and I get it at Aldi. But you can get Rabbit online, and I use it as my, like when we scramble eggs, or I will drizzle it over, any of our vegetables. I use it as a source in some of my cooking, like stove cooking. I wouldn't bake with ghee, but ghee is great for enhancing the K2. It also is rich in vitamin D. K and D are often synthesized and needed to be taken together, which is one of the reasons why I like the Douglas Labs. They also have the vitamin D3 that you need. They have a 5,000 KIU with the K2 and MK7. But ghee is great. Ghee is really easy to get into your diet. Even when I make soups, I'll add like a little dollop of ghee in there as I'm warming it up. If you guys have seen, I'm drinking kava tea this morning. This topic stresses me out. But I'm doing instead of, my little caffeine in quarantine. But I use ghee in also my, I just lost my train of thought. I use it in my bone broth. So sometimes I have bone broth that I drink with you guys. The bone broth, I'll do like a little dollop, not a whole lot, but it's a fat. It's very powerful. And what happens is when it gets into our system, it goes to the source that we want. It addresses that vascular channel. K2 is very good at breaking up the fibrins. The other thing that we need to address is, I mentioned it before a few days ago, and you guys had asked me a lot of questions about it, but I mentioned I do a lot of enzyme therapy and not digestive enzymes. We have a lot of different enzymes, and actually enzymes are what makes the body work. They're the signals. I talk a little bit like Gabriel's train tracks, and sometimes you have a divider, and whatever the signal is that sends the train one way, or switch it and the train that goes the other way. That's what enzymes do. So a lot of times when we look at some of these underlying health conditions or symptoms, there's often an enzyme deficiency, or the enzyme's turning on the wrong track. And by utilizing certain enzymes, and we're talking like metabolic enzymes, these are not your digestive enzymes. These are like the mighty, Gabriel watches, sorry, I'm in kid zone right now. He watches Paw Patrol, and now they have the Mighty Pups. Well, Paw Patrol is everyday digestive enzymes, and that helps us digest food. Then we elevate to like the Mighty Pups. Well, the Mighty enzymes are what we call proteolytic systemic enzymes. These are enzymes that are produced often, or should be produced by our body. They are systemic. They're all throughout our body, and they have particular function with proteins. So proteolytic enzymes is protein oriented, and they are enzymes that help our body stay balanced. And deficiencies in these enzymes, particularly like nattokinase and serrapeptase, will lead to potentially K2 deficiencies. they can actually lead to buildup of fibrin matter in our blood and in our, muscle and our tissue. So I use very specialized enzymes, and they're called systemic or proteolytic enzymes, and they are fibrin reducers. These enzymes literally metabolically break up and digest and remove these protein balls that we would consider clots. And, the clot that might occur because of a genetic issue or lifestyle or an underlying health condition like heart disease or, family risk. Also, in the hemostatic derangement that might be post-trauma. And post-surgically, I see a lot of patients who have, post-surgical hematomas, majorly intense bruising. Some of the surgeries are non-elective, and often a lot of the surgeries I do, lymphatic post-surgical healing work, are elective. Their facelifts, their tummy tucks, their body lifts, their liposuction, Brazilian butt lifts, breast enhancements. I can always tell from the post-surgical bruising what's going on in that patient's body. And often the labs will identify they might have deficiencies in the uptake of iron. So they're not absorbing iron well. They have way more bruising than they should. That is specifically from a K2 deficiency. And then because of that, the fibrin buildup, it minimizes the healing process. So this actually is part of my protocol in a post-healing state. It has to be used specifically and, with grace with some of the other medications or health conditions. But there's a product that I always recommend, and it's called Fibrin Defense. It's by Arthur. Let's see, what is the name of the company? It's let me see. I think it's Arthur. I just call it Fibrin Defense. I'm going to tell you. Oh yeah, Arthur Andrew Medical. And it is amazing because it has a ton of proteolytic enzymes. It has the serrapeptase, the nattokinase. It has bromelain, all of these really, really intense anti-inflammatories. And if we look at what has been identified with the blood clotting is intense inflammation, some sort of inflammatory state within the blood, the trauma. And again, we don't know if the virus is the traumatic source. Is it the stress of the body, the lack of oxygen? Big question marks. But at the end of the day, Fibrin Defense is fantastic. And, this is impactful for folks that have stroke risk, for deep vein thrombosis, for thicker blood. And a lot of times you may hear that. And I saw some folks mention in the comments that they have the blood clotting factors. It's not uncommon for you, if you give blood, for them to say you have thicker blood. And it can go the other way. Like they may say your blood's really thin. Like, what are you taking? And by the way, all the links are in the description box below. They link you to my full script store. And because of the nature of, demonetization and all of the other things that are really not making any of this profitable for YouTube creators, I'm now sending all of you to my clinic practice online store. So I hope you'll support my channel. If you're loving this information, not only give me a thumbs up, but most importantly, hit that button and buy through my store. I give 10% off, and I don't always promote myself and my products, but it really does help me maintain our live shows, especially with a lot of the changes in the creator space, not seeing clinical patients. It does help. So you can get those shipped out. Everything's in stock that I've listed. I even had a chat with them yesterday as I placed my own order. And I was like, we're going to be sending a lot of these out. And they're like, okay, we're ready. So just know that that really does support my channel when you go through those links. And, you don't feel it, but I do in a positive way. And it helps me give you this free content, because this is the equivalent of over an hour of an individual consult with me. And that value is over $150. So I just appreciate that. And I know a lot of you send me live chats every day. It's very, very helpful. And I know a lot of YouTubers don't discuss the monetary side of it, but there's something being called, they're calling it an adpocalypse. A lot of advertisers have cut advertising totally. So where, vendor or YouTubers were getting money from ads, they're not. YouTube's now censoring all of this information. They censor anything related to the virus, and they're not pushing this content out. It's very frustrating. So this just helps. So Vicky, I just saw you signed up. Thank you. Okay, so I want to go over, we've got ghee, omegas, fish oil, 369, 36579, amla, AMLA. That's a really good omega source. And it's great if you ever want to really enhance your skin brightness. Amla is great for the skin. That's an Ayurvedic. It's this beautiful orange little berry that grows on a little tree. Super, super beautiful. Very, very potent. And Clyde Simmons, thank you. Love how you support us with your facts. You support me, I support you. Mwah! Thank you for the $9.99 super chat. I'm grateful. And I put those out there, and I don't, have a call for live chats, but I appreciate it when you guys do that. So thank you. Thank you. You make my day. And Shalay says, I heard not skipping ads also supports your channel. Yes, that is very true. More people are doing live chats, more people are doing YouTube. And so now there's more of us, less advertisers, and, everything's spread thin. Unfortunately, I network with other YouTubers because this is not my area of expertise. So I try and learn from them, and a lot of them are closing their channels. They just can't sustain and support themselves because this might be just their only business. So I'm diversified. My main thing is my clinical practice. I did get a dose of reality after we had Gabriel in 2015 that my clinical practice was only as good as me being accessible and one-to-one. And so I had already put a kind of different business model in place to sustain, if we had another one, or, like with Brian, we had to close my clinic in Florida and move. I had this digital business that we already had laid the foundation for, but not everybody has that. And I'm very cognizant of that for all of my peers in the small business world, is not everybody has taken those measures or even have the ability to do that. And some still have to show up in person. And I didn't mention it today, but like Georgia's they're not trying, they're reopening tomorrow. Like you can get a tattoo tomorrow, you can get a massage, you can get your hair cut, your nails done, and you can go see a movie. And all of those, movie theater, but like all of those are really in close proximity and are definitely risky, but there's an onus on the small business owner that they now might have to have different HVAC systems. They need to have a different cleaning process protocol. They need equipment. They need PPEs. We have FEMA stealing stuff from Miami-Dade, hospitals and the fire department. How are small business owners going to get that? I still have masks that I've ordered that I haven't gotten. So I don't even know how that happens. Lori Preshaw, thank you. $5 super chat. Michelle. So Michelle, Instagram doesn't have that option. On YouTube, people can there's like a little money symbol at the bottom of a live chat, and they can hit that and contribute whatever dollar value. So, but the main thing is shopping my online store. And you can go to that via my website. So naturalhealthresources.com. I also have protocols. So I have a ton of already established written protocols that kind of pull together, 12 years, 15 years of expertise into what kind of drills down the best protocol for PCOS, Epstein-Barr. I've got thyroid, hormones. I have a lot of protocols. I think we have 28 or 29 protocols that I've written, and they're all digital guides, and you have access and download them. I have to change the prostate one. We get dinged on the emails as spam because of it. But I'm grateful. Okay, so let's see. Instagram's going to go off in about 30 seconds. Let's see. Good looking, honky. We are like a herd. The majority wants out to live. I totally feel you. Unfortunately, we don't have a herd situation right now in terms of our immunity. Let's see. Okay. So, and Instagram, I'll pick back up. I want to go through some of our questions here. So my question is, before Instagram goes away, was this helpful? Do you guys feel like this is new news? I know the COVID toes was really big. And I actually had several emails saying you feel like you've maybe had the virus and you had that symptom and you felt like there was a disconnect and you had an aha moment. So let me know. Okay, so Instagram, I'm going to end and save, and I'm going to post that. Super helpful. Okay. Yes. Okay. So what they're saying is that unlike the flu, this more than likely will not go away with heat. It has not been identified as a temperature-driven or managed virus. So that's going to be a little bit of a challenge. All right, so let me go back. I'm going to get Instagram live. Okay, we're bringing Instagram. Welcome back, Instagram. This is part 2 of our Instagram and YouTube Natural Health News live show where I'm talking about blood clotting as a common COVID-19 symptom. And I've highlighted a whole bunch of data. So if you want to watch the replay, the live will be down there. You can catch the part 1. But basically, let me recap for everybody, for all of you on Instagram joining. And give me a thumbs up if you like this list. So how to kind of incorporate anti-blood clotting food / supplementation to help your blood moving well, reducing the fibrins, helping kind of like fibrin reduction and utilizing proteolytic enzymes is like, I describe it as like putting Pac-Man, lots of Pac-Man into your body, and they just, and they run around and they eat the fibrins. They break up this really dense, thick protein that ends up becoming coagulated blood or, tissue in the muscle or scar tissue or whatnot. And I do have a list for all of you down in the description box below. So omega fatty acids, cod liver oil. I love fermented cod liver oil. That's my kind of go-to. I don't like it in a liquid form. I can only do capsules. Even when I was pregnant, like there was one that it was disgusting. So omegas are really good. Using butter oil, and that you can get in encapsulated form. Butter oil, I want to say butter oil and ghee. So ghee is the food-oriented form, and butter oil is encapsulated. But both of those, even though they are derived from an animal-based product and are considered butter oil, they are dairy-free. So a lot of folks that might have allergens to dairy products, they are okay with ghee. So I just want to put that out there because it is very, very healing. There's a lot of gut balancing. It's great for the skin. It's a great keto energy source as well for folks doing keto. And it's very rich in vitamin D and K2, which K2 is a very big vitamin. I have other content where I dig into that, but I love K2 and MK7. And that Doug Labs is linked below. And then also proteolytic enzymes. So nattokinase, serrapeptase, really intense protease, and the bromelain and all the other kind of systemic high dense metabolic enzymes. That's what we call enzyme therapy in functional medicine. Oh, Gloria, thank you. $14.99. I appreciate that. So it's really, really big in terms of, really supporting and lowering your risk of stroke and lowering your risk of blood clotting. Many of you know, and actually, let me see if you guys can see this. I don't know if you guys see that picture right there, right there on YouTube, Instagram, right here. So that's myself and Serena Williams. And I've highlighted this story before, but Serena found my practice in St. Pete because she was in a downtime healing post an injury to her knee or her ankle. She had glass that actually nearly killed her at like an SB ESPY or ESPN awards. And then from the surgery from that, she ended up having a pulmonary embolism and came to our clinic 6 weeks later. And there have been people who've even been on my live who've affirmed this. Like she came in multiple times, worked with several of our staff, and even brought in one of her camera crews. They were documenting one of her, it's out and published. We didn't make it in the April edition, but she came in multiple times and I worked with her on the scarring. She had really intense scarring and swelling and post-surgical work. And part of her situation, and she even experienced this after she had her baby, was she has a propensity to blood clotting. And that is what happened after her ankle surgery. And that is what happened after she gave birth. And I think she has a documentary on HBO. They highlight that, like, she was overly a forceful advocate for herself because she had already gone through a blood clot before and knew she was going through it again. And the nurses ignored her. And so there is definitely a connection to pregnancy, giving birth, and blood clotting. She experienced it. Fast forward to these women in the hospitals, they're seeing them go down fast. And the blood clotting, they're making that connection with the placenta. Also, the hormone changes. They can test negative up to the point they deliver, and then they test positive a day after. Like 25 hours is when they seem to do the testing. It's really bizarre. But she's an instance of a case, and we talked about this a lot. She was and is very restricted by the tennis association. So, there's like one supplement brand that she could use, and trying to figure out, like, how can you get some of these additional nutrients and still be in the guidelines of what you have access to. And food was one of the things that we recommended. But I say that because blood clots they don't discriminate. But they do coincide with heart-related diseases. So heart disease, and sometimes it is a genetic factor. And a lot of people don't even realize that. So in this video, part of it was to give you this new, quite alarming symptom and know about that for you, your family members, because that's another underlying health condition. It's a risk factor. If you have any history of deep vein thrombosis, high blood pressure, stroke, risk factors of stroke, family history, that's going to put you at risk. Does that mean you're going to get this or have this? No. But, what I want to do is for any of my normal, categories of patients that have risk factors, we want to address that with everyday exercise, good nutrition, and then supplementation that's going to address those imbalances. And that's what the omegas, the ghee, the K2, MK7, the fibrin reducing via proteolytic systemic enzymes, the metabolic enzymes are very powerful. So that's my gift to you all today. And, really and the butter oil, it's phenomenal. I think we would have a lessening of the rates of heart disease and stroke if everybody took butter oil, fish oil, take them separately, and added MK2 or K2 and MK7 into their program with systemic enzymes. And I'll give you a little tidbit of if you do grab the Douglas Labs, again, the link's down below. The way I like to recommend using these is at night before bed, so empty stomach. Take your butter oil dose and take your Douglas Labs dosage. At night, empty stomach, systemic proteolytic enzymes get right on into the bloodstream and they do what they need to do. So that's my little naturopathic tidbit. I had to unplug my phone. So I hope that's helpful. Would I recommend cayenne pepper? Cayenne pepper, it has particular properties in that, but I don't on this particular protocol. We need to go really powerful. Not that isn't, that's more of an anti-inflammatory. I'm not going to see major effects on a blood clot with cayenne. But that doesn't mean don't consume that. The curcumin and some of the other kind of reddish, orangey yellow, turmeric, they fall into that category of gentle blood thinning. They are anti-inflammatory, but there's a very different subset of like anti-inflammatories and like blood clotting addressing reducers. And so I separate those out. I wouldn't see that as being kind of the go-to. Jenny from the block, need to start my omegas again. Yes. So omegas, there's actually new research that's showcasing, potentially we need more DHA than anything in the omega category. But what I recommend, like to see about 2,500 to 5,000 milligrams. And again, you want to take that. Kenneth, thank you. Welcome. I would take your omegas separate. So vitamins or nutrients that are fat soluble, there's only one receptor and they fight. So I actually have a vitamin. I can detail this in a future video, but I have a vitamin protocol, and it's actually a brand that has identified like synergistic nutrients. They have a morning and they have an evening, and they separate the things that might be fighting each other so you max your absorption. And that's often one of the things, like your multivitamins. Sometimes you've got things that are just working against each other. Even if your vitamin and nutrient gets digested, you might not be getting all the absorption of those items, which is why I like to separate your D. I like to separate your K, your fish oils, your vitamin E. Let's see. Kim, what about evening primrose oil for thinning blood? It is valuable for that, but very different. Chalet says she gets nosebleeds after red spices. Yeah, and some people have allergies to these items. What happens if you can't do those things, just vitamins? I would try and separate the vitamins if you can. What about blood clots due to endometriosis and polyps? K2. Big evidence. I mean, there's a lot more at play. K2 will help minimize that, but that I have a protocol. I have an endometriosis protocol. Endometriosis is an inflammatory disorder. We don't recognize it as that. Most OBGYNs just want to DNC you or remove your uterus and not really address the underlying components. But there's a big thyroid, adrenal, ovarian factor, and so we have to balance that. We didn't know to not take fish oil with D3. Doc informed us. So grateful. Oh, thank you. The link to the store. So if you go to the description box below, my website link is there, but the actual the products, there's an affiliate link. It's a bit.ly link, but you just click on that. That takes you right to the full script site. If you've already signed up, you're in. All you have to do is give your name, first name or whatever, an email. Then you gain access, and you can buy anything. Inside the whole entire store is 10% off everything. We have great lines, teas, pet products, skincare, animal or pet, not pet, baby products as well. Lots of good stuff. Some of the items might show up, chilled. We have probiotics, they're all the high quality professional grade brands. They do a very good vetting process of all the brands that they do have on hand. And we have 2 locations. So East and West Coast we're shipping out. Carography Studios. It is excellent. I purchased it and I have been following it step by step. Yay! I'm a patient with endo stage 4. Your CBD recommendation has changed my life. Oh, yes, my herbal botanical. Love that stuff. And by the way, Octagon Biolabs has a new soft gel, and it's liposomal, which is really exciting. So that, if you go to my main website, you'll see you can take a quiz for that. You'll see it front and center. I'm in my white coat. You just click on, you can buy it straight off of there. The code, it's my first name, Melissa, and then the 3-letter botanical. Gloria, does apple cider vinegar work as a blood thinner? I haven't seen any specific data to that point, but it is a very good pH balancer. I love apple cider vinegar, especially on the skin. What's the best way to eat ghee? I know nothing about it. Okay, so ghee, I should have brought it. It's in the same kind of glass container as like a coconut oil, And it's kind of like a yellowy substance. Sometimes room temperature, it'll be a little liquid. But like I do a dollop and throw it in a pan. And if I saute vegetables, if I'm doing eggs, I will use it as that. You can also use it as a butter. It doesn't taste like butter. Like, it's ghee, it's clarified butter oil. So that's what it really is. And this again is an Ayurvedic in its origin. But ghee is something that you could use as an oil base. You could add it to soups. You could add it over your vegetables, or, throw it in your meat if you're consuming any type of meat. I'm not aware of any like salad dressing with ghee, but again, I don't tend to be like salad dressing forward and like creating that. But let's see, use as you would butter. Yes, that is right. You could totally use it as you would butter. But I have never cooked with, like, I have never baked with ghee. In my baking, I use coconut oil. That's my alternative, and it makes everything taste so fabulous. But ghee is great. Janet, I have my mother in a nursing facility, and she has HTN, COPD, and his history of DVTs and clots to lungs too. If she is on meds for those, is she still on higher risk if she contracts? Yes, she is. So all of those underlying conditions, even medicated, and that the JAMA New York report actually drills down further into folks that are already medicated. It's better if she is, but those health conditions, medication or not, are there, and those are underlying health factors. So, and often a case like your mother, where she has HTN, COPD, and DVTs, she's probably taking 6 to 8 pills, more than likely. So there's the medications that are a factor. And I have heard, I didn't find it in any of the literature specifically, but I've heard that they've had to also calibrate the dosing for some of those folks. Okay, so Dr. Berg has K and ox bile to break it down. Is that good? Ox bile is more digestive. So let's see, future video separation. Okay. Yeah. Okay. So let me write that down. So how to take, there's an actual term for it. I can't remember it right now, but it's like the latest term is I think it's synergistic vitamins, but it's about synergies. Like some you want to take together and some you don't want to. Like obviously we know bees, B vitamins, they're like best friends. They all hold hands. And that's how I've always kind of remembered through the training that if you want B12, you have to take a B complex for B12 to be optimized. And then there are different types of them, different forms. Tiki, thank you very much for informative content. I tried serapeptase and it worked well for a while. Then I started having heart issues when I take it, like palpitations. Any recommendations? So one of the things, friends, to know that, depending on the brands that you take, they're often additives. Sometimes they're soy. So there might be some allergen sources in some of the products that you take. That's one of the reasons why I really love FullScript, is we really minimize a lot of the sources of allergens. And I mean, minimizing soy, wheat, all of those. People don't realize gluten it sneaks its way into your supplements. But serapeptase is one, depending on how much you take, how you're taking it. And again, I don't know your health history, so I really don't know what to recommend. But, I don't always use proteolytic enzymes for a long period of time. Often it's a very specialized, like 2 or 3 months, or we're dealing with scar tissue and really need to break it up. So just know that, like, some of these are not going to be long-term. Nutrient synergy. Okay. All right. So I'm writing that down. All right. So if you guys like this content, give me a thumbs up. Let me know that you're loving this. Let's see. I just lost, let's see. I just saw a question. Okay. What about if a person has a DVT, PE, and on a blood thinner? So MAR-JN, that would be something, consult your doctor first and foremost, and consult your pharmacist. Warfarin is one of the ones that is commonly prescribed and what you don't want to do is you don't want to take anything that can make your blood too thin. And I do work with patients who end up coming off of some of those and opt for the alternatives. But that's a really specialized dance, and it has to be played very well between your practitioners and the providers in the care. But definitely one of the things that we do see is that you can thin your blood too much, and then you can run the risk of a bleed. And so that is, I do want to say this, one of the things that they did see was that there was some cases where they had bleeding, like extensive internal bleeding. But the blood clotting was the biggest factor of that. Okay, so I've heard MSM is good for viruses because it oxygenates the cell to keep the virus from penetrating. Viruses hate oxygen. Yep, that is very true. And there's all different types of ways to get oxygen. That should actually probably be a topic. Let me write that down. You guys always give me great ideas. Okay. Let's see. Many known to be healthy patients have had strokes with this virus. To many unknowns with this virus, scary to go back to normal. Yeah, Darlene, and this is a very common fear. And I think we saw that play out. Oh, the squirrel, you guys, I have a new feeder out there, and that little bugger, it's like one of these little houses, and I got a whole nut mix delivered from Aldi, and he is hanging upside down on the house, cleaning it out. I wonder if it's the mommy squirrel. But yeah, to go into town. So anyway, okay, sorry, I get distracted. I should at some point have it where you could see the squirrels. It's quite entertaining. Okay, so yeah, so Darlene, going back to that, Georgia, there is some backlash to the prematurity of opening. In fact, where our clinic is, it's in just what they call outside the perimeter of Atlanta. There's a highway that goes around the metro. And the clinic literally is like right at this major cross section. It's insane traffic wise. It takes me like an hour and a half to get to the office in the morning, which is insane. But the mayor of Sandy Springs was quoted, and I think it was in a local paper, and I think it got picked up in some national news. I saw a lot of banter last night on Facebook about it, but she was quoted as saying, this is too premature. She's like, I've talked to a ton of business owners, and I don't know anybody who wants to open. I think there's two big concerns here with opening too fast. As a business owner, we have to be equipped. We've got to have PPE. We have to have distancing practices, cleaning practices. The question is, do you take temperatures of everybody coming in? Do you give your patients, your customers, your employee? You have to equip your employees with safety, but do we require that of the customers coming in? What about those that think this is bogus and don't want to do that? And then also there's this whole thing about negative pressure to minimize the growth of the virus. And I didn't mention it today. It was on my list as I researched, the day before, but there was an article, and it was a small snapshot, but it's data out of China where there's a restaurant, and they've identified that 9 people were exposed to the virus because of the air conditioning. And there was one person who was positive, and either knowingly or unknowingly, I don't recall. But they through contact tracing, they can start to identify, okay, they were at this restaurant, all of them ate here. They started to identify, okay, one person had tested positive or had it, and the air conditioning unit was moving this virus. Here in Georgia, tattoo parlors are going to be open tomorrow. Yeah, tomorrow. Tattoo parlors, massage facilities. I used to have 6 rooms for massage therapy. There's often smaller rooms. A lot of times you're just renting space. You don't have full control over the build out. If you do, you're going to have to build it out. That's a big expense. And then do you put UV air filters in every room, but you've got an HVAC that's circulating all this air? I have no words for that. So, that's like on the business side. But then as people who want to get back to making money, what Sandy Springs Mayor said is, yes, people want to get back to working. But if we have businesses open, one, now it puts the businesses, they have to use the PPP that if they got it, they have to either rehire or bring back their employees. But who's going to be frequenting them, and how are they going to be making revenue? We can have a bigger economic situation because of it. I just don't know. So we're going to go slow. We're not changing our methodologies here. Luckily, Brian's boss said, he's from Australia. He's like, this country is crazy. And he's like, whatever you do, you're stay at home, be safe. So, that is, I don't know. I don't know what to say about that. I also read last night and sent to several of my friends in Florida. They're projecting the Tampa Bay market in Florida to have the biggest hit. They're expecting like 10 to 12% of an economic hit to businesses, to investments, and even unemployment. So long term, Florida will definitely get rocked harder than Georgia will, at least Atlanta. I used to have a big subset of snowbirds. A lot of people go down there for vacations, and people have second homes. That will impact the real estate market. I'm seeing like 2008, 2009 kind of swirling. I'm hearing friends starting to freak out like they did back then. Any correlation with insomnia and clotting factors? I am not sure, but I can look and see. I know that one of the reports that I get from people is as they take like the fibrin defense, they will feel like stuff's happening. The description is like, I feel like there's sometimes a little crampiness, maybe even like a headache, and that dissipates. And I don't know if that is the feeling of these fibrins getting broken up and getting processed out of the body. I don't know. That's a good question. So I've never made ghee. All right, so let's do this. I know we've been on for a while, and I really appreciate all of you tuning in. Do me a favor, you guys. Give this a thumbs up. Hit the share button. I will post and share this video to my Facebook page. I actually have a private Facebook group. I'm going to invite you over to that. It's my Facebook page is at Your Natural Health Resources. Instagram too. I'm trying to post more frequently on Instagram and Instagram stories. Excuse me, I've been talking a lot. I'm a little dry. But one of the things that, especially for all of you on the live on Instagram, if you guys screenshot this or the live or on the replay, share and tag me. Once we hit first, like 10,000 is apparently this magical threshold that as soon as we hit 10,000, we get the swipe up feature, and I can swipe you up to YouTube channels or swipe you up to like things I mention in the live. Then that just allows me to send you up to that versus you having to run over to YouTube. So any of you YouTubers who are Instagram lovers, our handles at Natural Health Resources. And I hope you'll follow me there. So we're almost there. I think we're about 350 away. It's slow. But I appreciate your time, and just want to thank each and every one of you for tuning in, participating, asking insightful and thoughtful questions. And with this particular situation, this is just new, and we just don't know. There's going to be a lot, especially this is just a ton of research that's just gathered currently. And you think we've only really been documenting this since the end of February, March, 1 month. So there's a lot of unknowns, and just bird's eye view assessing of trends. We have some amazing medical providers, really intelligent individuals that are seeing and then acting and new protocols happening. It gives me chills because that is the best of American education and expertise, and just trust in this process. I know it's frustrating. I get a lot of comments, one, this is a hoax. I had somebody comment on yesterday's. I threatened him, like, if you keep spreading this misinformation, I'm going to block you. But the reality is it is not a hoax. This is a real situation. Whether the morbidity mortality rate is where it is, based on how many people have it, we just don't know. We don't have enough testing. We don't have the antibody testing. Abbott Labs put out that they've got that test, but people aren't using it right. So they're getting all these false negatives. Well, that's helpful. And then we have no PPE, and it's being seized by the government. So we have a lot of chaos happening. But in the midst of the chaos, we have clinicians that are starting to see things, and they're analyzing abnormalities, and they're making progress. Are they making progress on there's no cure? The scientists are going to make progress on analyzing what medications are already on the market that we can use. With the clotting aspect, that might change the assessment and the clinical trial that's happening at Beth Deaconess Israel Medical Center up in New England, up in Boston. That might change the direction and trajectory of how we address this, at least for these folks that are more prone or have these underlying health conditions. So there will be progression in how we treat and address this disease, and this virus is an unknown. And the symptoms and how it's presenting is nothing like anything any of us have ever learned in any of our medical books. The ICU, ER doctors, when they're trying to reference stuff to do, that nothing exists with a situation where you have your nephrology, your machine that is your dialysis machine, and the catheters are getting clogged because of blood clots. Like, that's craziness. Like, that has never occurred. And because of it, it's dumbfounding a lot of providers, but they're savvy and they're smart and they're collaborating. And that will get us in a better position as things do open up. We will start to see additional protocols. So have faith in that. I hope that is somewhat inspiring to all of you, because it can feel like we're out of control. There's this hopeless situation, but we are humans, and we're inventive, and we have intelligence that allows us to deal with whatever situation. And the fortitude and the intellect of these clinicians, boots on the ground, they're seeing it every day, and they're all starting to talk and collaborate. I mean, this, if anything, this journal, literally the list of all the parties and all the medical communities that are involved. I mean, these are all of the medical facilities. I mean, it's a huge list. There's research happening. They are gathering data, gathering information. This will help us. So just have faith in that. I'll keep equipping you with info. My goal for tomorrow is to do our Talking Shit show. So I originally had that planned on Wednesday, and then the COVID toes came up. I was like, oh my gosh, I have to tell all of you and get that out there. And so, yeah, thank you. Thank you for everybody. Thank you for all of you who did the super chat. I'm grateful. And do frequent my Full Script store, and have a great rest of your day. Be safe. Order your masks. Tomorrow I'm going to wear one of my fun virus-related Etsy store shirts. So I hope you'll join me for a little caffeine and quarantine tomorrow morning, 9 a.m. All right, friends, I'll see you then. Bye, Instagram. And thanks again, YouTube, for your participation. I am beyond grateful, and I appreciate your time. All right, have a good day, everybody. Bye.